The shoulder refers to a region and not a specific joint, as the shoulder is made up of 4 different joints. The sternoclavicular joint is the joint between the sternum or breastbone and the clavicle or collarbone. The acromioclavicular joint is the joint between the acromion process of the scapula or shoulder blade and clavicle or collarbone. The scapulothoracic joint really isn't a true joint, as there is no connection between the bones, but is the space between the scapula or shoulder blade and the thorax or posterior rib cage. And finally, the glenohumeral joint is the joint between the glenoid of the scapula or shoulder blade and the humerus, which many people are actually referring to when they use this term shoulder joint. There are a total of 16 muscles which act on these 4 joints. Listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. These will again be displayed at the end of the unit for your review. Movement of the scapula on the posterior thorax or rib cage is important to have good range of motion in the shoulder. When there is cause for pain in the shoulder region, a person tends not to move the joints as much due to pain. This often causes what is called frozen shoulder syndrome, when the muscles get tight and the scapula does not move well over the thorax. The movements of the scapula are listed on this slide, which include elevation and depression, which we do when we shrug our shoulders, abduction or protraction, and adduction or retraction, which we do when we reach forward and back, and upward and downward rotation, when we reach above our head and bring the arm back down. Glenohumeral joint movements between the glenoid of the scapula or shoulder blade and the humerus include abduction and adduction, when we bring our arm out sideways away from the body and back toward the body, flexion and extension, when we reach forward and backward while keeping our arm at our side, and lateral or external and medial or internal rotation, when we rotate our arm at the glenohumeral joint. In order to best understand the 16 different muscles of the shoulder region, I've divided them into categories based on the bones which are connected by the muscles. Therefore, there are 5 muscles that attach from the trunk of the body to the scapula, 2 muscles that attach from the trunk of the body to the humerus, 7 muscles that attach from the scapula or shoulder blade to the humerus, and 2 muscles that attach from the scapula to the forearm. These muscles will be presented in this order and described by their action, origin, and insertion. 3 of the 5 muscles that attach from the trunk to the scapula are on the posterior of the body and are shown here. These 3 posterior muscles attaching from the trunk to the scapula are better shown in this graphic. The trapezius is a thin muscle that covers over much of the upper back region. Its major actions are to extend the head and neck, elevate and depress the scapula, and to help stabilize or hold the scapula against the thorax or chest. The origin of the muscle is the base of the skull and the spinous processes of C7 to T12. The insertion of the muscle is the clavicle or collarbone, and the acromion and spine of the scapula. The levator scapula action is primarily to elevate or raise the scapula and tilt the head to the same side. It originates on the transverse processes of C1 to C4 and inserts on the upper medial border and superior angle of the scapula or shoulder blade. The action of the rhomboids is to primarily adduct the scapula, but they also assist in elevation of the scapula. They may be divided into 2 sections. but I will simply refer to them as one muscle. The origin of the rhomboids is the spinous processes of C7 to T5, and their insertion is from just below the levator scapula to the bottom of the scapular medial border. The two anterior muscles which attach from the trunk of the body to the scapula are shown here. The serratus anterior primarily acts to abduct the scapula or move it away from the spine. Its origin is the upper 8 or 9 ribs, and its insertion is the front side of the medial border of the scapula. The pectoralis minor primarily acts to depress and abduct the scapula or shoulder blade. It originates on ribs 3 through 5 and inserts on the coracoid process of the scapula, which can be seen as a forward piece of the scapula located under the clavicle or collarbone. Two muscles attach from the trunk of the body to the humerus and are shown in this diagram. The pectoralis major is the major muscle covering the chest region. Its major actions are to adduct and medially or internally rotate the humerus. It originates on the clavicle or collarbone, sternum or breastbone, and the first 6 ribs. It inserts on the front of the humerus on the greater tubercle. The latissimus dorsi is one of the biggest muscles of the body on the back of the chest and lower back. Its major actions are to extend and adduct the humerus at the glenohumeral joint. It originates on the spinous processes of the last 6 thoracic vertebrae, the last 3 or 4 ribs, and the posterior iliac crest of the hip. It inserts on the upper front side of the humerus on the lesser tubercle. There are a total of 7 muscles that attach from the scapula or shoulder blade to the humerus. 4 of these muscles are posterior, 2 are anterior, and 1, the deltoid, caps the top of the shoulder. Shown in this graphic are the 4 posterior scapula to the humerus muscles, along with the deltoid. The remaining 2 scapula to humerus muscles are anterior and are seen in this graphic. Viewing from the side, one can see the deltoid muscle, which forms a cap or covering over the top of the shoulder. Its main action is to abduct the humerus at the glenohumeral joint and to also assist with flexion and extension of the joint. This muscle originates on the clavicle or collarbone and the acromion and spine of the scapula. It inserts on the deltoid tuberosity approximately 1/3 of the way from the top of the humerus. The coracle brachialis helps to flex and abduct the humerus at the glenohumeral joint. It originates on the coracoid process of the scapula and inserts just in front of the deltoid tuberosity on the anterior humerus. The teres major assists in extending and medially or internally rotating the humerus at the glenohumeral joint. It originates on the lower half of the lateral border of the scapula and inserts on the top of the lesser tubercle on the front of the upper humerus. The next 4 muscles which attach from the scapula or shoulder blade to the humerus are a group called the rotator cuff muscles, because their main function is to assist with motion of the humerus within the glenohumeral joint while helping to hold the joint together. The supraspinous muscle is found on the back of the scapula on top of the spine of the scapula in an area referred to as the supraspinous fossa. Its major action is to abduct the shoulder at the glenohumeral joint. It originates in the supraspinous fossa and inserts on the top of the humerus at the greater tubercle. The infraspinatus muscle is found in the back of the scapula below the spine of the scapula in an area referred to as the infraspinous fossa. Its major actions are to adduct and laterally or externally rotate the shoulder at the glenohumeral joint. It originates in the infraspinous fossa and inserts on the back side of the greater tubercle of the humerus. The major action of the teres minor is to adduct and laterally or externally rotate the humerus at the glenohumeral joint. It originates on the upper lateral border of the scapula and inserts on the humerus on the back side of the greater tubercle. The fourth rotator cuff muscle is the subscapularis. Its major action is to medially or internally rotate the humerus at the glenohumeral joint. It originates on the entire anterior surface of the scapula or shoulder blade and inserts on the front of the humerus at the lesser tubercle. The final two shoulder muscles are the biceps brachii and triceps brachii, which originate on the scapula and insert on the forearm. Though they each mildly assist with shoulder movements, their major functions are to flex and extend at the elbow joint, and therefore will be discussed in the video lecture next week. Frozen shoulder syndrome, or adhesive capsulitis, was referred to at the beginning of this lecture video and is explained in more detail on this slide. Pause the video to take time to review this information, as it is a common problem that you will see in practice. Another common problem due to injury is a tear to the soft tissue or labrum that is found within the glenohumeral joint and can be very painful with any movement of the shoulder. Again, this is a problem you will probably see in practice. Pause the video to take time to review this information. As at the beginning of the presentation, listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. It is suggested that you should begin to study for a test on these muscles by using study cards with the name of the muscle written on one side and the actions and attachments of the muscle on the other side.